When our patients get up in the morning and they take their mandibular advancement devices out, oftentimes they'll feel like their teeth don't touch together the same way in the morning that they did the night before. I'm Steve Carstensen. I'm the Clinical Education Director for Airway Technologies, and I'm here to tell you about the new AM aligner. In the mornings, our patients have to reseat the condyles, have to reposition the tissues that allow the condyles to function, all to allow the mandible to return to its normal alignment so that the teeth will fit together. How do we do that? We've made custom devices. We've given them non-specific little tabs to chew on. We've made full arch AM aligners out of thermocryl. We've made thermocryl AM aligners that go from cuspid to cuspid. The newest innovation is a full arch thermocryl device. It's the same kind of thermocryl we've made MyTaps out of for years. We've made the liner for DreamTaps out of for several years. So this versatile material, which isn't plastic and it isn't petrochemicals, what it does do though is it molds over your patient's teeth. You heat it up in hot water, you put it over their teeth, they bite firmly into it, cool it down with a little air, and within a minute or two, you have a new AM aligner that's custom made for their teeth, and it's tough. The original thermocryl sometimes would break, especially for your patients with a deep bite or with a highly connected anterior coupling. So it would form thin spots in the thermocryl material, the AM aligners. This forms thin spots as well for those same patients, but this is a tougher material. So they can put it in place, they bite down onto it, they can put soft pressure like we would counsel them to, and eventually they can put hard pressure on it without breaking the thermocryl material. And they feel great. And they take it out, check their bite, put it back in, work on it a little bit more, take it out, check their bite. It's super easy to use. And it looks good, it's professional, it's got a little handle on it. That's, I guess, my favorite part. So with a little handle, they can grab it like this, they can put it in place, they can take it out. It's super easy for them to understand how to use. It's super easy for them to use, and it takes away the barrier for them getting their bite back together in the morning, the thing that dentists worry about the most. When I've made, over the years, hundreds, thousands of the ones that go from cuspid to cuspid, how many patients have I had that have said, oh, I lost it. It got lost on a trip. I can't find it in my bathroom. Can I have another one? Of course, we'll make them another one, but isn't it better that they can have something that's not easy to lose? So the new AM aligner is, I think, a superb step forward for Airway Technologies. I'm excited to use this for my patients. The ones I've used it on so far find it super easy to use, and I think you will too.